Welcome to The Remedy, brought to you by NYC Health and Hospitals, innovating public health care to benefit all New Yorkers.
Hey everyone, I'm Michael Shen, and welcome back to The Remedy from New York City Health and Hospitals. Today, we're talking about what it means to build a truly sustainable health system, one that cuts down on carbon emissions, strengthens climate resilience, lowers costs, and improves patient care at the same time. At NYC Health and Hospitals, that work is actually already well underway. From sweeping energy efficiency upgrades to large-scale rooftop solar projects and flood protection systems, our system has reduced operational carbon emissions by 30% since 2006, with an ultimate goal of cutting operational emissions in half by 2030. So joining us today are two leaders driving that transformation: Omer Cabuk, the system's first Chief Decarbonization Officer, and Tennille Santos, Director of Energy Programs and Project Delivery. Omer, Tennille, welcome to the show.
Thanks for having us.
Thank you. Grateful to be here.
So I'll be honest, I didn't know that your roles existed, and I'm so excited to learn that they do exist and that there's so many projects ongoing that I had no clue were happening. I wanted to start with this question about, most patients, when they're thinking about hospitals, they're thinking about the quality of clinical care. They're not really thinking about the quantity of carbon emissions and all that. Omer, can you help us understand why is sustainability so important to healthcare delivery?
Thank you for the question, Michael. So there are a few aspects to it, right? The very first one is whenever we implemented like a sustainability project, like in other words, a lot of the energy efficiency projects that we implement, it helps the environment tremendously, given the fact that the healthcare facilities do have a large environmental footprint, right? So the first thing is, let's say if we reduce the amount of the gas that our boilers use on site, that's going to translate to the reduced emissions for the neighborhood. Therefore, it's going to impact positively the patients who live in the area in terms of if they have a pulmonary disease, any kind of the asthma or the heart disease, that's going to directly impact them, right? And the second thing is whenever we reduce our carbon footprints, a lot of times it translates to energy efficiency, that translates to dollar savings. So whenever we pay less money to the utilities, that means it's more funds available to us to inject into our healthcare delivery system. And the third thing is, whenever we do all these great projects, that then we make ourselves more energy efficient, and that means we are needing less electricity or natural gas, in some cases, some district steam, whenever there's a significant weather event, when there's let's say power outage, right? So if your facility is more efficient, that means your emergency systems can last a lot longer. So that also makes you in the past, we are required to have 96 hours of emergency power available to us, in case of a grid outage, or same thing with the gas grid. If it goes out, we need to have 96 hours of a fuel oil available to us just to be able to maintain our mission critical functions of the facility. So, but then if you're more energy efficient, more sustainable, that means you can go beyond 96 hours, right? And during Sandy, I think we lost power for up to 8 days for some of our facilities. And the last thing I want to mention about is, a lot of the projects we do is we introduce this new mechanical equipment, much more efficient, and also new control systems that translates it to better indoor air comfort and also the ventilation quality for our patients. So that also positively impacts them as well.
Yeah, so it sounds like it's not just kind of our commitment to the environment as a health system, but also directly affecting air quality for our patients, affecting the clinical quality for our patients, and also our preparedness for a lot of big things like, storms and such. So, I think I find this to be the case is I'm so concentrated on the clinical care and kind of how we deliver care at the hospital. I don't really think about all this stuff that's kind of in the background. I want to know, why should patients and New Yorkers care about our sustainability efforts in the hospital?
The healthcare facilities resource heavy, right? We use a lot of energy, a lot of water, and also a lot of the resources. And that has an adverse impact for the environment. So that's why I think every New Yorker, and also when it comes to the emissions, some of them are on-site emissions, that impacts the air quality of the surrounding neighborhoods, right? So it's important for New Yorkers to be aware of it. And also, when we are a public health, system, if we become more sustainable and use less resources, that means in return we can just, treat more patients and we can allocate more resources for their well-being.
Tennille, from an operational perspective, how significant is, we're a really large system. How significant is our environmental footprint?
So just to give some context to this, I'd like to say that healthcare industry contributes about 8.5% overall to the total greenhouse gas emissions and about 5% globally. And as we all know, Health and Hospitals is the largest municipal healthcare system in the country. So needless to say, we have a great environmental footprint, right, to help mitigate that. The energy team, as we are called in the Office of Facilities Development, is charged with implementing programs and initiatives that help mitigate scopes 1 and 2 emissions. And so what these emissions are attributed to energy-consuming assets that support our day-to-day operations. So they are the building systems and equipment that, provide the heating and cooling, the hot water, the improved air quality, right, through ventilation, water, and air distribution throughout, right? So these are the utilities that are essential to keeping our doors open and quite literally our lights on, right? And enable us to keep the doors open to provide the healthcare services to our community and also to provide a quality environment for our staff and overall our occupants and patrons. So we do this, we're strategic in doing this in 3 tactical ways. Omer mentioned, we do energy efficiency work where we go in and replace equipment that have reached its useful life with a high energy efficiency model, and we integrate controls to help and improve operability. Secondly, we do decarbonization work where we look to decrease our reliance on on-site fossil fuel use and through decarbonization strategies, reclaiming waste heat to repurpose it into our thermal systems to reduce that usage. And lastly, we try to integrate renewable energy into the mix. And these are clean energy sources that generate thermal and power on our sites, like solar PV.
It's a lot of exciting work, and I actually want to talk about some of the major milestones so far. There are now 2 rooftop solar installations, one at NYC Health and Hospitals Elmhurst, which is one of our hospitals in Queens, and also NYC Health and Hospitals McKinney, which is one of our nursing homes in Brooklyn. What makes those projects really important? How have they affected those hospitals, those nursing homes?
So they reduce our reliance on conventional grid power overall. And as you know, and Omer alluded to this earlier as well, our power plants are usually located in our community, in our backyard, and they are often considered high polluters and pose some high health risks, right, to our community. So they are reliant mostly on the burning fossil fuel combustion, which, leads to health risk, like Omer mentioned, high asthma rates, right? So we're doing our part not only to offset our energy consumption, but we're also hoping that we are impactful in reducing the load that these utilities, basically we're reducing our load and the need to, these conventional power grids also are oversubscribed most times and have to supplement with peaker plants. And we're hoping that, reducing the load will reduce the need to bring these peaker plants as well online.
What are peaker plants?
So peaker plants are, they're usually offline of the utilities, but they come online to supplement the conventional grid, the base load power plants in times of like summer cooling where the demand is high and a lot of, our conventional grid is oversubscribed.
And also those projects, the solar PV projects, that both locations, like those are some of the areas the grid is extremely strained when it comes to infrastructure. So they experience sometimes the brownouts, which means like they have the voltage reductions throughout the summer. So having those solar PV systems in those areas also helps the grid stability throughout the, the city. So that's one of the also important aspects as well.
In addition to those solar projects, other kind of larger energy upgrades that we're doing as well?
We are extensively doing upgrades across our facilities of the lighting system. So we're upgrading fluorescent fixtures with high efficiency LED technology, and we're integrating controls to optimize, the usage when, eliminate usage when there's unoccupied places, right? And that alone will decrease the lighting consumption baseline by over 40%. We are also looking to do major upgrades and overhaul our building management systems. And these, this is essential where the systems and equipment speak to the platform where building operators and engineers are able to see in real time, what these equipments are doing, how they're operating. They can control them, monitor them, and identify any issues, pretty quickly. We're also working to upgrade chiller plants. We did the one at McKinney where we replaced the chillers and integrated heat pump technology there. And we're wrapping up a design at Elmhurst, right, where we're doing a comprehensive energy efficiency project there as well. Also includes lighting. We're doing major upgrades to their air handling units to be sure they're operating correctly and also reducing their energy usage and also their chiller plant. The chiller plant is the equipment that produces cooling for the system, for the facility, basically. And through chill water, we run that through air handling units and do the heat exchange of taking in the heat from facilities and basically pumping in colder, tempered air to the sites.
So a lot of people are maybe familiar with the room air conditioners, right? Because that's what they have in their apartment. So the average, like the room air conditioner, we call like a 1 ton of cooling. I'm not going to get into technical details, right? But 1 ton, let's just know that number. But then for like a large hospital systems, you need maybe 2,000, 3,000, or in the case of Bellevue, for when it's 100-degree day, you need 7,000 tons of cooling. So you can't just have 7,000 air conditioners because they're just going to cool the environment, even if you're able to install them. But then there's also ventilation requirements. When you bring the outside air, right, you need to depend on which area you're serving. If it is an OR, you need to humidify it during the winter time. And also there are certain air changes that needs to occur based on the ASHRAE 170, the ventilation guideline, just to keep, areas ventilated and just to keep our patients safe, depending on what area it serves. That's why you have these large chiller plants with the cooling towers on the roof. And that allows us to do like a large amounts of cooling in a very large facility.
Yeah, when our hospital leadership talks about cooling towers, I'm like, what are you talking about? Cooling tower? We have a tower? But actually, I think what I find so fascinating about this conversation is just like first of all, this is all like invisible almost to us on the ground doing, the clinical work and probably to our patients. It's invisible in the sense that I have no clue what's going on inside the walls. But I will tell you, just in hearing you talk about all these things, the connections I'm making to clinical care, which is like, for example, it's always very, like the air is cool in the hospital. Wherever you are, it's pretty cool because like, I think the hotter it is, just like the more, maybe like the humidity, it's just not good for the equipment. It's not good for patient care. Oftentimes, if rooms are too hot, for example, people with heart failure or certain other conditions can be really affected by like heat. I noticed that the environment is good for patient care because it's kind of at a stable, temperature. And I do also know that, yeah, of course. And like during times of like COVID or like isolation rooms, we're thinking about which direction the airflow is going and like the kind of filtration systems that we're talking about. And just talking to you makes me realize how much energy that takes or like how much work that takes to maintain all that. So just thank you for your work.
I think it takes a village to do that, but a lot of our facility operation teams and the engineers that we have, I think that there are a lot of amazing people out there to make this happen. A lot of times it's the out of sight, out of mind mentality, right? Because these systems are in the bowels of the facility, basically. And if you won't notice something until it goes wrong. So, if you lose your heating system, then all of a sudden you realize, okay, but then somebody has to do something in the boiler plant just to troubleshoot certain things.
Yeah, and shout out to all our maintenance teams around the system doing all that work. Sustainability is one piece. We're talking about kind of the carbon footprint of hospitals, et cetera. But the other thing we talked about, which is really important and how it kind of directly affects our operations, is climate resilience. So since 2014, our system has actually completed some major resilience projects, including flood protection, hardened infrastructure, and stormwater upgrades. Omer, what changed after Hurricane Sandy that shaped how we think about climate risk?
So before I answer that question, I'll take a step back and go back to 2007. So 2007 was the time that under the Bloomberg administration, they passed the NYC plan. Pretty much that plan addresses the city, how the city population is going to go up another 1 million by 2030, and how to address all the infrastructure, what's energy, transportation, water, as well as sustainability under that. So they passed a bunch of laws, right? So around, those laws started to pick up steam, around 2012, 2013. Now they were getting more attraction, but the resiliency wasn't really on nobody's radar. Up until October 2012, the Hurricane Sandy hit the city. And unfortunately, a lot of, entities, including the healthcare systems in the city, had to learn their lesson, the hard way. And our system got impacted very adversely. We have the few facilities that got significantly flooded, the flood damage. I think the Bellevue Hospital, also like the Coney Island or the South Brooklyn Health with the new name, and the Kohler Hospital or the Kohler long-term care facility on Roosevelt Island, and the Metropolitan Hospital, they all sustained different levels of damage. And unfortunately, we had to kind of evacuate the patients from both Bellevue Hospital and as well as, I know that back in the day, there's the Coney Island hospitals. And a lot of folks, and this didn't only happen to us, it happened to, other healthcare systems in the city. And they realized that the hospitals that were designed maybe 50, 60, 70 years ago now are not meeting today's needs when it comes to large climate events. So that was the turning point for our corporation. And fortunately, we were able to obtain some FEMA funding. I think it's somewhere between $1.6 to $1.8 billion. And that's the time we started to harden our infrastructure by, raising the boiler plants above 500-year floodplain, by relocating some of the electrical infrastructure from the basement to the upper floors, right? Just building maybe some small, either like a flood wall or some sort of like a protection, whatever we couldn't raise. Sometimes the oxygen tank, you cannot just raise it, it's got to be outside somewhere. So we did a lot of great projects, which I'll probably talk about a little bit more in the upcoming moments.
That just reminds me of the flood that we had at Woodhull in October, was like a little over a year ago now. Yeah, we shut down a lot of our clinic operations because of it. And we had to move a lot of patients, which the teams did a really great job with. But I think, just bringing it really home, there's a map somewhere online that I've looked at where if you just look in 50 or 100 years, which places will be flooded. It's kind of crazy, how many areas in Brooklyn and across the city, But I want to mention a few examples. So you mentioned flood walls. So we have a flood wall at NYC Health and Hospitals Metropolitan in East Harlem, designed to withstand a 1 in 500-year storm. I'm going to ask you what that means. Another is the climate resilient new building at NYC Health and Hospitals South Brooklyn Health in Brooklyn, which you mentioned. Can you just talk a little, well, first of all, what is a 1 in 500-year storm and how scared should we be?
I'm not the storm expert, so I'll put the disclaimer out there, right? But my understanding is even the Hurricane Sandy, I think if you look at the initial, I think the weather, the forecast, I think 48 hours prior, they were thinking about maybe the flood levels will be around 6 to 8 feet, right? But fast forward to that day, I believe it was beyond 14 feet because the storm met the high tide at the perfect time. That's why we got so much flooding, and that was unanticipated. That's why some of the hospitals, they didn't even take a chance, or they didn't even have the opportunity just to evacuate because according to the weather forecast, I think provided by NOAA, national, the weather service, wasn't that significant, right? So my understanding is a 1 in a 500-year storm, all these, the elements get together and just created a situation that's going to be detrimental to, just the facilities. Usually it comes in the form of flood or sometimes very high speed winds.
Tell me a little bit more about how these projects that I mentioned really help hospitals maintain their operations.
Sure. So a lot of times these climate resilience projects is mainly just to protect the equipment, right? It's the cooling system, the heating, the boilers and the chillers and the electrical systems. So this way we can still maintain the mission critical functions of the facility, or even there's an interruption, those systems are still protected. Even if you had to evacuate the hospital for a day or two, then you can still bring back the patients and you can still continue where you left off, right? Because usually the flood waters recede after 8, 10 or 12 hours later. But then if you sustain a significant damage, you won't be able to do that, right? And when it comes to the flood walls, I think the Metropolitan Hospital had quite a bit like the flood damage, especially a lot of their mechanical equipment in the low-lying areas, and you won't be able to raise them, their boiler plant as well as their chiller plant. So that's why I think they came up with the flood wall over there. And we also have a couple of flood walls. That work has been completed more than a year ago now. And we have a couple of flood walls that are in the works. One for the Kohler Hospital, it's in the design phase, and also the Bellevue Hospital as well. They're going to have a flood wall there. And I believe South Brooklyn Health, their flood wall should have been completed as part of the new building, which they call it a climate-resistant building, because they sustained quite a bit damage during the Hurricane Sandy. And instead of spending, all this capital dollars to kind of fix what has been damaged, it has been determined that it's better if we just build a brand new building that's going to be much more climate resistant, so that the current building that they have, everything is all pretty much elevated. Whatever they couldn't elevate, they build a wall around it. Their emergency department is on the second floor, so there's a ramp, like you literally go up there. And so, and their like windows are like pretty much shatterproof. I don't want to call them shatterproof, but they're very, even if there's 140 miles of like winds, their windows won't break. So there are a lot of great features in that building.
Wow, things I don't think about.
There are other projects. I'm not going to get into too much detail, but we raised the boiler plants at the Kohler Hospital because after, their boiler plants sustained quite a bit of damage. Same thing with the Coney Island Hospital. The boiler plant that supports the main building has been also elevated above the 500-year floodplain. So our system is in a much better position compared to, like the prior to Sandy. And also a couple of years ago, we have completed a climate resiliency study just to see where the shortfalls are. And this way, that gave us a great idea. And we completed that study because our system signed the climate pledge like almost 4.5 years ago now with the Health and Human Services. So as part of that pledge, we just kind of committed to put a like climate resiliency study out there, which we completed. And now it's going to be, we're using that information in the planning, the capital planning for our projects for the future to come. So this way, we are hoping that for the years to come, we're going to have a much better hardened infrastructure. Hopefully, we will never have to put that to test. But if it happens, we'll be ready for it.
Tennille, a lot of decarbonization progress we're seeing comes from modernizing a lot of the infrastructure behind the scenes, things like lighting system upgrades, HVAC equipment upgrades, and smart building management systems. I know a lot of our buildings date back to even like the 1930s and all that. How is it to kind of upgrade these old buildings with new technologies, and what does that look like right now?
So we are looking to, as we go and design and spec out equipment with newer models, right? They have smart technology built into it, whether it be sensors or digital controls that are able to improve operability and a direct connection. They communicate to each other, right? And back to the front end and the building management system. So overall, we're increasing our reliability with operations, right? Having these insights directly, you can't measure what you can't control, and you can't do your day-to-day operations without the proper controls and monitoring capability. So we are laserly focused on building management system upgrades where building engineers and operators have that ability to be able to operate and address any issues in real time.
One thing you mentioned earlier, which isn't particularly a new technology, but which I really love for my own home, is like LED lighting. Because honestly, I hate fluorescent lighting, and fluorescent lighting in hospitals is just like it's bad for mental health.
Some of the newer technologies that Tennille and I have been working on is from one manufacturer, you can change the color temperature of the light, right?
Yeah.
So you can make it more yellowish light if you choose to. It's within the same fixture.
Right.
So we find that that's useful for us because if it's in a patient room and if they, yellower light, it kind of helps people just to kind of
set the tone, set the mood.
Yellow makes you mellow, I think.
Yeah. Warm lighting,
Yeah, it depends on the application for sure. And with controls, you're able to also, dim down the lights as needed and,
Yeah, I always wonder about our clinics at night. The lights are on, but nobody's there. And so I think having more control over that is also really a good thing.
And there's a local law 88, and Tennille can speak to that. It's just that also requires us, not only us, all the entities in the pretty much city, that the buildings over a certain square footage, just to install these controls, whether it's in the form of daylight controls or vacancy sensors, just to make sure if the room is not being utilized or if there's enough sunlight coming from the window, there's no reason for us just to, to keep the lights on, or we can dim them depending on the need.
Yeah, and that's local law 88.
Correct, yes.
And since Earth Day 2024, we've actually been able to reduce annual emissions by nearly 6,000 metric tons. And that saved us about $2.5 million as a system in annual energy costs. So Omer, how do you continue advancing sustainability goals while navigating some of like the funding challenges, especially that we're anticipating facing with, a lot of cuts to things like Medicaid, which we subsist on, right? How are we continuing to meet our sustainability goals in the face of that?
I think that the finance is extremely important, right? You have to be kind of the creative and a lot of times try to think out of the box, to deliver these sustainability projects to make it like a significant impact. So we approach this the couple of different perspectives. The first one is anytime there is a large capital project in our system that involves like a mechanical, electrical, or plumbing systems, a lot of times either we deliver the project ourselves, or sometimes if it is being delivered by the director of capital projects that we have in our system, they come to us and we work together. So we basically try to kind of kill multiple birds with one stone. If it's like, let's say, a rooftop unit replacement for like a small clinic, should we just replace it in kind as the business as usual? Or can we convert that unit to maybe like a heat pump rooftop unit where we, instead of using the gas, maybe we can use electric, the heat pump, and just to cover most of the heating that's needed for the facility. And this way, once the grid gets cleaner in the future, so our carbon footprint is going to be a lot less. So that's one aspect of it. So we try to kind of incorporate sustainability or decarbonization measures into our current capital program. And the other thing is, our program delivers a lot of energy efficiency and sustainability projects because of the local law 97. You probably heard about it, or some of our listeners who's listening to us now. Basically, the city as a whole needs to reduce its operational emissions by like 40% by 2025, 50% by 2030, and 80% now it's net zero by 2050. So we need to do our fair share. So in order to do that, we work with our partners like DCAS Division of Energy Management. They provide significant funding to a lot of our energy efficiency projects. And we also try to Tennille works very hard to take advantage of some of the incentives and rebates from the utility companies. Every little dollar counts, right? So we work. And lately, we're trying to take advantage of some of the NYC grants and as well as the IRA funding that's available from the federal government. So we try to be resourceful and look at all these different options just to deliver all the projects that we do.
Yeah, that makes sense. And so, local and also federal policies really, really make a big difference for us in terms of getting those incentives and being able to fund all this work to help our environment, honestly. You guys have already achieved a 30% reduction in operational carbon emissions since 2006, and the target is 50% by 2030. Tennille, what's the next step to get there?
Yeah, well, we definitely have our work cut out for us, right? We'll continue implementing projects to reduce our energy consumption, which in turn reduces, our emissions profile. We're lazily focused, as I mentioned before, on completing all the lighting upgrades throughout our facilities, as well as the building management systems, overhauling them. And that's essential in operations, as I also mentioned. We'll continue to conduct energy audits to find opportunities for energy efficiency, decarbonization, and integrating renewable energy. But I don't know, Omer, did you want to add?
No, I think you covered everything pretty good. And also a lot of the, that 50% is not going to be only our doing, right? So the grid also has to do their fair share. So there's they call it the Hudson Champlain, the Power Express project that's going to be bringing some high hydropower from Quebec to the New York City. And, I think the city is heavily relying on that just to make the electricity grid cleaner. That's why there's this big push towards electrification, because once the renewable energies make their way into the city and when we electrify, so then we're going to be relying a lot less on the gas. So we're also counting on that just to meet that 50% goal.
We gave a shout out to some of the frontline maintenance workers, and I want to recognize all those teams doing all this work on the ground. Can you tell us a little bit about what our frontline engineers and facilities teams, how they're making this all real?
when it comes to, like times are changing, right? So a lot of our facilities, they have this old infrastructure, as you mentioned earlier, right? Old buildings, but then all those old buildings also have very old boilers and very inefficient, like the cooling system, so on and so forth. But a lot of our engineers are kind of used to operating that kind of mechanical equipment. So now times are changing. There are like newer technologies that are available when it comes to controls. Now we're switching from pneumatic controls, like the direct digital controls, which is, like pneumatic is pretty much like the pressurized air, right? And now we're just doing everything's getting more complicated. If I use the car analogy, like 30 years ago, when you lift up the hood, like, you would know what is what. Like, okay, that's engine, that's transmission. But now you open the hood, like you have no idea because there's so much electronics. And same logic applies to our building operations, right? So it's important for us to work with our engineers and engage them in the process. So in the end, you can give them like the brand new state-of-the-art mechanical camera control system, but if they don't know how to operate that, or if they're not engaged since the beginning, you're not going to get the best bang for your buck. So that's why whenever we're doing a project, we are, working with them closely because they are the boots on the ground. They know their facilities best, right? Sometimes they make these great recommendations, and we try to kind of also work with those colleagues just to give them the training that's needed. Because when you have a high pressure steam boiler, you have to operate a certain way. But when you have a water source heat pump, it's a different story. Like now you need a different skill set. So, and we work with those folks, and we try to kind of push these, like the newer stuff. But it takes a village to accomplish all of this. It's the facility operations teams, the engineers, their leadership, our leadership. So it just takes a lot of, and also our external, like the colleagues, which I mentioned earlier, like the DCAS and some other agencies, or the Con Ed, the National Grid. So it just, everybody together, in this.
We've talked a lot about a lot of things, but you guys also have efforts in other departments like IT, food services, and even anesthesia that really affect kind of our sustainability across the system. Can you tell me a little bit about those projects?
Before I answer that, I'll talk about, we've been talking about decarbonization, right? Because the carbon represents the highest percentage when it comes to greenhouse gas emissions. So, but that carbon represents actually 80% of the greenhouse gas emissions that are being emitted. So there's like 14% that is methane. Then there's the 6% hydrofluorocarbons that I think the anesthesia gases fall in that category, but they have a very high global warming potential, right? So not all the anesthesia gases are created equal. So in our system, we use quite a bit like nitrous oxide, and a lot of them were initially in like a centralized system because infrastructure being old, we have had a lot of leaks and we just couldn't really, control that well. And a couple of our great anesthesians, anesthesia folks, they have anesthesia council. And a few years ago, they said, why can't we just, instead of using the centralized system, can we just do like a point of use, right? And when they did that, in some facilities like Bellevue, they have seen like 90% plus savings in terms of the emissions. And these things, when it comes to nitrous oxide, it's 2,000 more potent, or like, compared to like a regular CO2, right? So that's why it's extremely important. I think so far, like 4 facilities switched to this, but I think in a year or two, we're just pretty much going to see this like the system-wide. And when it comes to also the anesthesia gases, desflurane is the most potent amongst those. And our system is slowly and steadily switching from desflurane to sevoflurane or isoflurane. They have a lot less global warming potential. And I think we made quite a bit headway. So the kudos to them. I'm just aware of, what's going on, but they're the ones who's put in the hard work. And a lot of the decarbonization work happens in different departments, right? That was one. And the other one is our food vendor, Sodexo, because we have a facility in the Kings County Hospital called like Food Services Building, or some people know it as the Cook Chill Building. And they pretty much cook all the patient food for all our hospitals as well as long-term care facilities there. And a couple of years ago, they made a switch to more local produce, and they have also reduced the amount of the meat that's being used, right? And I think they were able to accomplish 36% in their like the food-related emissions. And I think that was a big accomplishment. At the same time, I think they also achieved like 90% patient satisfaction. So I think that's great. And when it comes to the IT department, and those folks are also doing an amazing job. Given our, we have, I think, 42,000 employees, right? Almost everybody has like either a notebook computer or a laptop. So, and also I think a lot of folks also has cell phones too. So when it comes to that, every 4 to 5 years, you have to kind of renew this equipment. So they're working with a third-party vendor just to do like this sustainable recycling. And also, I'm pretty sure everybody knows about the unprint initiative, right? If you don't really need it, just don't print it. And they're reducing the number of the printers that they have in our system. So, everybody's trying to do their fair share to the best of their ability in our system. So, which is great to hear.
Yeah, it's true. It kind of is all across all the departments. We're trying to cut down on the number of printers in our clinic and how much paper we use. And just to go back to food, in our first season of The Remedy, we actually did a food episode where I went to the Sodexo plant and saw that in action. We're going towards a veg kind of forward, food services and all that. Again, just all of this invisible work that takes place kind of behind the scenes that I'm really happy to bring forward because sustainability is really our way to the future for all of our kids, our society. So I really appreciate all the work that you guys are doing. Thanks so much for your time. Is there anything else you'd like to add?
The motto that we have in healthcare is the first, do no harm, right? So I think it's, as healthcare, organizations, it's our utmost obligation just to make sure that because we have a very large, like a carbon footprint or environmental footprint, so to speak. So it's our obligation. The numbers that Tennille gave earlier is like staggering numbers, right? We have a big impact. So it's our jobs just to make sure to become as much sustainable as we become, and also just to reduce our environmental impact. So that will have a positive, I think, impact on everyone's lives or the communities that we serve.
Well, that's all the time we have for today. Omer, Tennille, thank you so much for joining us.
Thanks for having us.
Yeah, thank you.
Healthcare systems exist to protect public health in more ways than one. By reducing emissions, strengthening resilience, and modernizing infrastructure, NYC Health and Hospitals is showing that climate action isn't separate from healthcare. It's an essential part of it. Thanks so much for joining me. Don't forget to subscribe and leave a review wherever you get your podcasts. I'm Michael Shen, and I'll see you next time.
This podcast was produced in partnership with Amaze Media Labs.